Okay, good afternoon, everyone. Today is Monday, and here we are. Health is wealth. Our health is our wealth, as I always say. We are so happy. We have today with us Dr. Rashmi. Share the wine with us. I will tell you about her. Before that, I want to welcome all of you, and I want to welcome Dr. Rashmi and Dr. Kalra. You have seen Dr. Kalra, and I, for the new people, I just want to say that she's in this community for more than 35 years, and she's a oncologist, hematologist, and cancer specialist of breast cancer and some other kind of cancer. And community, she's helping with us community. And then today we have with us Dr. Chardavoyne, and she's well-known surgeon at Northwell Hospital System, mostly at LIJ Hospital, where she started her practice more than 35 years ago. And she specializes now in general surgery and breast surgery. And she was pioneer in bringing laparoscopic method of surgery at Northwell Hospital System. And she's also friend of Dr. Jack Kalra for more than 30 years, and they share lots of patients together. And she will answer any question you have um, on Zoom, on after Zoom also. So we welcome you, Dr. Sharda Vain, Rashmi ji. Welcome to Health is Wealth. And I will give the podium to Dr. Jack Kalraji.
Hello,
And
everybody.
one more thing. Today we are going to, of course, we are going to discuss surgical solution of common abdominal pain.
Of course, very important topic. Hello, everybody. Good afternoon. And of course, welcome to Dr. Chardavoyne and Jyotiji. Always thankful to you for bringing all these things to the community so they can benefit. We like to share our experience. And like you said, Dr. Chardavoyne and I have been working together for a long time. And it is so nice to be with her. We discuss patients right away and we come up with the best solution. We don't say that, oh, kal kar lenge, parso kar lenge. We discuss every case the same day. So that's good to have good friends and good doctors in this community. And today she's going to tell us that don't be scared if you have abdominal pain. There are different kind of pains, like I said last time. Though some pains are important we have to do something right away. And some pains, you can do some home remedies and say, okay, I can make an appointment with the doctor. So today she's going to tell you what is the one that you can wait for an appointment and the one you should do act right away, which is a very, very important decision to make for all of us. Hanji, Rashmi ji, Dr. Chardavoyne, I call her Rashmi. Go ahead.
Thank you so much. Thank you, Jyotiji and Jagmohanji. I'm here to talk to you about the surgical solutions really of abdominal pain. Not all abdominal pains require surgery. So last week I saw on the thing Dr. Kalra covered the anatomical part of the belly, meaning to say which right side, left side, upper, lower, and what are the organs that are in that area that can cause problems. So I will not tell you that in detail, but I'll talk to you about different things that different reasons that you can have pain. A very short list of pains that can be caused by medical problems. Now, people, most common in women especially, is urinary tract infection. You can get pain from urinary tract infection, and it can be really bad at times. You can have fever, you can have chills. So this is something you need to be aware of. Other problem that women can get is infection in the pelvic organs called PID. That can also cause lower abdominal pain and fever and vaginal discharge sometimes or most of the time. Diabetes itself can sometimes present at abdominal pain. We see patients in the emergency room who come in with diffuse abdominal pain, and basically their blood sugar is like 400 or 500. So that can cause pain. The other problem that cause pain that does not require surgery right away are kidney stones, stones in the ureter, and other vascular problems that can be very serious. For example, ruptured aneurysm, dissecting aneurysm, or something called you can have dehydration and you can get ischemia, meaning to say low blood supply to the abdominal organs like intestine. Other causes that can cause pain and may not need surgery are Crohn's disease, inflammatory bowel disease, or ulcerative colitis. Now, talking about the surgical problems itself, I'll go over by disease, so let me tell you about the appendicitis. Before I say anything, and Dr. Kalra mentioned, like, when should you really be worried about abdominal pain? The abdominal pain is very common. We get it here and there, and after some time it gets better. Anytime you have severe abdominal pain, lasting more than 20, 30 minutes, needs urgent care. Pain that is not getting better and getting worse. Getting worse, you start having fever, chills, or anything, needs urgent care. Pain that's lasting more than 2-3 hours, need to go to the emergency room or call your doctor. So any pain, severe pain, needs urgent care, may not need operation, but needs urgent attention. So with people with appendicitis, talking about individual disease, mostly present with the pain around the umbilical belly button. Once you have a pain around the belly button, in next hour or so, it settles down in the right lower abdomen. You can have some nausea, vomiting, and you can have constipation. So those are the classical symptoms, but sometimes just abdominal pain, and that started in the middle abdomen and then goes down to the right side. We always think of appendicitis. In women, we also think of other problems like PID, I mentioned, UTI, and ovarian related problems like ovarian cyst, twisted ovarian cyst, or ectopic pregnancy. Some of these things are urgent. For example, ectopic pregnancy, you have severe pain and you basically can go into shock, and that needs urgent, super urgent care. So the appendicitis problem, if your pain doesn't get better, you're not feeling well, and if you move your legs and arms and you hurt in the belly, it is a bit serious. So you need to go to the emergency room. Fortunately, I have been in practice for 35 years, and before we used to make diagnosis by examining, talking to patients. Nowadays, you come to the emergency room and they send you right away to CAT scan. It has made our life very easy. Before, I used to make, say, diagnosis 85% of the time. 15% of the time, we could not make the diagnosis. That means that we were wrong 15% of the time, but there was no way of knowing it. But now with CAT scan, it's nearly 100% you can make a diagnosis if it is appendicitis or if it is not appendicitis. Not having appendicitis is also important because then you look for other areas or reasons for for the pain. The treatment of appendicitis has changed a lot. In my days, I would get a call at 3 in the morning that I have a patient with appendicitis. I would say, okay, let's go to the operating room. Nowadays, if you have a mild appendicitis, we don't operate on you right away. What we do is we put you on antibiotics and see how you respond. Most people with mild appendicitis will respond within 24 to 48 hours. And then we send you home on antibiotics, and it's very likely that pain may or may not come back. If the pain comes back and you have appendicitis again, then we treat you the same way and then do the operation once the infection is gone away. So that is for mild appendicitis. If they think you have a lot of inflammation around appendicitis, we treat the same way. You should respond. If there was a lot of inflammation around the appendicitis, then these people, we would suggest taking their appendix out 6 weeks later. So that way you can come in, have the operation done, and go home the same day. It is called interval appendectomy. So that means we do remove the appendix after infection has subsided. The third category is the abscess, the small abscess. And most of the time, if it is right in the same area and it has not spread to the rest of the inside, we again treat the same way. But what we do is we have the radiologist drain the abscess so that we can treat you with antibiotics. And again, if you respond, bring you back in 6 weeks and do the operation. So that really is the appendicitis. Important thing is that not to wait too long. If you are during the office hours, call your doctors. They will tell you, they may send you for CAT scan, so you don't have to sit in the emergency room for 6 hours or 10 hours. So it is important. If the weekend, please don't say it's a weekend, I'll bother my doctor. Call and get some advice. Most of us are available on the telephone. A lot of problem like Dr. Kalra, whole weekend she was dealing with it, sitting in Dallas, taking care of a medical problem. So most of us are available on the phone, and we know we have the resources to guide you and tell you what to do. We can contact the emergency room, we can contact the people, contact the residents, people that will help you guide, take you through the emergency, even if we are not there. So it's important, don't ever hesitate, because it's your life, not my life, not anybody else's life. It's your life. If you take care of it right away, after appendix, you are back to work in 2-3 days. If you wait and have perforation, some people die from perforated appendicitis, so please don't wait. So that is just the appendicitis. If somebody has any more questions, I can.
Dr. Rashmi, I have a question. Somebody, Asha Du asked why we get bloating. If you can answer that.
In appendicitis or
Just
overall?
general, she wrote why we get bloating. You know.
The bloating, the most common cause of bloating is constipation. If you have constipation and you don't go to the bathroom, there are a lot of gases that built up, and the gases are the ones that cause bloating. Other causes are that if you have a gallbladder problem, typically they're described, one of the symptoms is bloating. You feel like your stomach is getting big. And sometimes I would tell you, people who are very, very anxious, very nervous, they swallow a lot of air. When we go to do our gallbladder surgery, I go to do gallbladder surgery. Sometimes we can't do it because the stomach is so full of air. We have to put a tube and empty it. So when you are nervous and you are swallowing a lot of air, a lot of air is passing through your system, you feel sometimes bloated, etc. Other serious causes, I am not telling you, because you can have tumor or cancer in the colon that can cause blockage. You can have tumor in the small bowel that can cause blockage. Inflammation, appendicitis can cause blockage. So the blockage of the intestinal passage can also cause bloating, but the most common cause really is constipation with buildup of gases. Gallbladder can cause problem also.
And anxiety, they have a lot of burping. People who burp a lot, is they're taking the air. Like I see that all the time. They just keep burping. So yeah,
You
that
should
is,
put that on silence.
yeah.
You're
I
too
want
busy,
to know I'm
doctor.
alive here. I'm here. Very good. Yes, yes,
Yeah.
yes.
So the next
And one person asked, they have very heaviness in the stomach, but you told, what to do
Yes.
and what can, the reason for that. Heaviness, yeah.
heaviness, just remember one thing. A lot of patients ask me a whole lot of questions. A lot of these problems come from a lot of weight. If you are obese, you're carrying a whole lot of fat, whole lot of skin fold, etc. That itself can cause some of these problems. So it is always a good thing to watch your weight, and overall, not just for the bloating and all, but overall your diabetes, high blood pressure, all these things. A lot of people are quite obese and then they wonder what is happening. And a lot of these problems are coming from that. So something to be aware of. So the next topic I thought I would take is the gallbladder. The gallbladder, I see a whole lot of gallbladder. I mean, you mentioned it. I started laparoscopic surgery at LIJ, and I have done thousands of gallbladder operations. So I see a whole lot of gallbladder patients. The difference between, say, since 1990 and before is that before we used to see only patients with acute symptoms. Patients with a really severe pain, fever, and a lot of inflammation, etc. But since the gallbladder surgery started, somehow it seems like anybody who has little problem, they do the sonogram of the abdomen, see the stone in the gallbladder, and we do operation. So we don't really see really serious problem. The difference is that when you have a serious gallbladder infection, and if you have to operate, which we try not to, but if you have to operate, the problem with injuries to the major organs, problem with the bleeding, infections are much, much higher. Also, older people can die from operation done on really badly acute gallbladder. So the idea is not to wait. So most people with gallbladder will have the same kind of pain. You start around the umbilicus, belly button, and then it goes. And once you have infection, if you have only stones and you're getting what's called biliary colic, you may not have pain in the right side. It may stay right in the middle of the abdomen. You get pain on the right side when the infection starts setting in. Then you have pain on the right side. So if the pain starts in the middle and goes on the right side, if it comes and goes, for example, it comes for an hour and goes away, then it's not that serious. But if the pain is there and it is not going away, then it is a problem. Then any pain that lasts more than an hour or gets worse, you need to seek attention right away. Abdominal pain, there could be 1,000 causes. And I always tell patients, it's not what we are doing when you come to us. What we are trying to do is trying to make sure that the most serious thing is not happening. For example, if you are coming with abdominal pain and bloating, we want to make sure you didn't perforate a diverticulitis. You did not perforate stomach. And stomach perforation, you can get really big bloating. So we start out with the top of the line, what's the most serious cause you could have, and then work our way down. Nobody has a real answer like right away, this is what you have, except if you have a hernia and you feel it and it's tender, that's different thing. So we work our way down. So the people who come with abdominal pain in the middle of the abdomen settles on the right side, you need to call your doctor. They will, first test they will do, and the best test to do for gallbladder stone, finding out if you have that, is an ultrasound of the abdomen. If you do the ultrasound, then it will show you stone. If you do CAT scan, 70% of the time you will not see any stone, because the stone that are present in the gallbladder does not have enough calcium to show on CAT scan or flat film. Sometimes you can do abdominal X-ray and you see big stones, but it's very rare because, like I said, nobody waits for them to be like that anymore. So if you have gallstones and you have pain that comes and goes, your doctor will send you to a surgeon. You come to me, I tell you, you should have surgery. Now, a lot of people tell me, why should I have surgery? I don't have pain anymore. And I tell them, you're lucky you don't have pain, because sometimes you'll have such bad pain that you'll end up in the emergency room. You will stay there for 6 to 8 hours before you get a surgeon to see you or something like this. Then emergency operation, if they do it, sometimes they'll tell you, by the time they give you 1 shot of morphine or something, you'll go home because the pain is gone. And then you can start all over again. So best thing is, once you have symptoms and you have gallstones, you're better off having the operation done as soon as possible rather than wait. Now, again, sometimes the gallbladder can be very serious when you come. I had a drawing I was showing. And
yeah, show the drawing. Yeah, that's good. Yeah. Okay.
What I'm going to show you is, this is the stomach. This is your liver. It's 10 times bigger than this. And this is your stomach coming down like this. The gallbladder sits under the liver, so that it is under the liver. So when we go in, we have to lift up the liver to see the gallbladder. Otherwise, you don't see it. Now, the function of the gallbladder really is this. Liver makes bile. Bile is a juice along with other 100 things that liver does. But the green stuff, the bile that is made, it comes down through the liver through this major duct called common bile duct. I made it yellow, and it comes down like this behind the liver and goes into this part of the intestine called duodenum, first part of the intestine, small intestine. And then it is absorbed, it is used in digestion of fat mostly. But after it is used, the bile is a very precious substance. So it is absorbed back in the blood, goes back to the liver, and then cycle goes on. So when you are eating food rich in fat, the bile comes down to this small intestine. And between the meals that you're eating, not eating, the bile is stored in an organ called gallbladder. So gallbladder is just a storage organ. It is not something like produces something and it's very like crucial. If you remove it, you probably will not know what happens. If you get a stone in the gallbladder, say for example here, if you get a stone here, it blocks gallbladder to push the bile into the small intestine. And that is what causes pain. And then sometimes if it relaxes or your need is gone, the pain goes away. The serious problem is if you have many stones in the gallbladder and one of them drops into the common duct. If it drops into the common duct and gets stuck here, that's a very serious problem. That can cause backing of the bile in the liver. People get jaundice, you can get fever. And the other important thing that Dr. Kalra spoke, the organ pancreas that sits here, it can cause pancreatitis. The most common cause of pancreatitis in Long Island, for example, is gallstones. Other most common, that used to be more common than gallstone, was alcoholic. So people with alcohol drinking a lot can get pancreatitis, but the gallstone is another cause. So prevent that also. It's important to do the gallbladder surgery. What we do is we make 4 small cuts for gallbladder operation. We make a cut around the belly button, another cut here and 2 small cuts here. We go in with the camera, take out the gallbladder, and you go home the same day. This is 95% of the time. There's a 5% chance, suppose it's very inflamed or there's bleeding or something, the anatomy is not right, then only we cut you open. And if we cut you open, the cut goes like this. Even with that, you stay in the hospital for 2-3 days, but for elective gallbladder, you go home the same day. What we do in the operating room is we go in, look at the gallbladder, we take out the gallbladder at this part with the stone and take it out and you go home the same day. Now that the gallbladder is gone, bile is going straight to the intestine, back to the and like this. Other thing is this, that if there is another condition called gallbladder polyp, the stone is like this and moves around. Some people get something called polyp, which is like a little dot here. Like in the colon, you get polyp, you get a polyp here. If the polyp is 10 millimeter, then chances of having cancer or gallbladder increases. So up to 10 millimeter, and there are no symptoms, we don't tell you to take the gallbladder out. But if 6 months or a year later, the gallbladder polyp goes from 3 to 5 millimeter or 7 millimeter, we can also do another test that's called HIDA scan, which shows us if the gallbladder is working with the polyp or the gallstones, if you have no symptoms. If the gallbladder is not working, then it's no reason to keep the gallbladder there and take a chance with the polyp. So that's when we take out the thing. So this is the gallbladder problem. Most of the time people say, oh, I know people get fat after you take out the gallbladder, and people have this and that. Most people really have no complications, most people. Some people may get diarrhea in the beginning, but most people are happy because they have constipation. But it gets better by 6 months or so. So that is the gallbladder basically. More than that, I think another thing, important thing about gallbladder is that people who have no symptoms and we find gallstones by chance, it's called incidental. Then the operation we suggest to people are diabetic, people who have immunocompromised diseases, because if they get infection, they cannot handle it quickly. So those are the patients we tell you to remove the gallbladder. So that is about the gallbladder itself. The third problem that we see with, I think Dr. Kalra mentioned it to you last week, about the gallbladder, typically how it is described. It is described in 5 Fs. One is 40, female, 40-year-old female, fat, fertile, and flatulence, meaning to say they get a lot of gas. So those are symptoms of the gallbladder, and typically, but now, like I said, even I see 20 years old, 15-year-old, and they're not fat.
How about fair, Rashmi? How about fair people? Fair, fat, 40, female, fertile.
Now you're being racist.
Oh, so good. Yes, yes. We
Dark,
need to
dark
put that.
people also get gallbladder.
No, that, I think I won't get gallbladder problem. I'm not fair.
Hey. Okay, so the next thing, a few things I think is like diverticulitis.
Yes.
Now, diverticulitis mostly happens in older people, mostly. But you can have it even in 30s and 40s. And why some people do get that, we don't know. Most of the time, diverticulitis is an acquired disease. That means it comes with age. As we age, our bowel ages and they get some weak areas. Once in a while, you kind of can be born with it. And I think the people like 30 or 40 years old, they get it, they probably are born with it. And those people perforate faster than the older people do. Most of the time, same thing, the pain starts in the mid-abdomen and kind of settles in the left lower quadrant, left lower abdomen. If you have pain in the left lower abdomen and it's lasted, most of the time diverticulitis pain doesn't come boom like that. It is not that way. It comes slowly, gradually. You have constipation, you have pain, and then it doesn't get better. If the pain lasts for more than a day or two, same area, you need to seek advice, because all you need is a CAT scan to find out if your colon is infected or have with diverticulosis or diverticulitis. It is a serious problem. Again, it's like appendicitis. If it's mild, we treat you with antibiotics. If it's moderate, we try to treat you with antibiotics. If it has gotten the abscess, we try to drain it first, and then you need a resection of the bowel. Now, most of the time, I'll show you the picture again. This is the area of the colon, which is on the left side. If I put it on my stomach, this is the right side, left side. This is the part of the colon that gets diverticulitis mostly. So this is the area, so you get pain on this side. Problem with diverticulitis is that this is also where most of the time the cancer occurs. The cancer of the colon also happens in the same area. So sometimes you can have a cancer that can cause infection, can cause perforation, and present as abscess infection. So it is hard to tell whether it is from cancer or diverticulitis. So, but the treatment is the same. We treat you with antibiotics. We treat you if you have an abscess, we drain it. And then after treatment with antibiotics for 2 weeks, and if you respond, we always advise the colonoscopy 6 to 8 weeks after this episode. So you want to make sure there is no cancer there. If this was the first episode and without abscess, we follow it. Most of the time, there's only 30-40% chance you may get it again. Most of the time, you will not get another infection. But if you had a pus, then you need to get operation. And the operation for that is that we take out this part of the colon, which is the left hair, up to this hair. This part we take out. But if you have a big abscess, then sometimes we cannot hook you back up together. We give you something called colostomy, which is temporary most of the time. What happens is that if you hook this back up together, it can break down. And once you have a breakdown, it's very, very bad complication, very bad. People die from it. So this is the reason, and people say, oh my God, colostomy, but that's a lifesaver. It's a lifesaver because if you leak hair, there is no stool going through, you will survive. If you leak hair and stool is passing through, it's a nightmare for surgeons and the patients, both of them. And another thing is that if the infection is very, very low, this is your anal opening down here, the infection is very, very low, sometimes we can't hook you back together, especially with cancer. Then what happens is that we may hook you together, I send patient to Dr. Kalra, she gives radiation, chemo, whatever. Once in a while, we can't hook you back together. You may end up with a permanent colostomy, but it doesn't happen with diverticulitis. It happens mostly sometimes with cancer, lower tract cancer, lower colon cancer. And the appendix, just to show you, is on the right side. which is opposite of diverticulitis. That's a small organ like this. We go in and cut it out like this, and you go home the same day. So diverticulitis can be serious. All these things can be serious, but if you are aware that if the pain is there, do not ignore it. Just do not ignore it. Persistent pain, even for more than 6 hours, you need attention. So diverticulitis, that's one thing. And the last thing which I would tell you about, which is very, very common, I will not talk about kidney stone because kidney stone is not very,
We will
very acute.
That's separate because we have 2 minutes, Rashmi ji.
Okay, so the last problem is the hernias, abdominal wall hernias. If you have a hernia, you can get acute pain. If you have a groin hernias, they can get stuck. The bowel can get stuck in the hernias, can cause blockage, bloating, etc. And if you have a pain and a lump or ball in that area, lower abdomen, that's an emergency. I always tell people, lie down, bend your knees, take a deep breath and see if you can push this hernia back. Most people know how to push it back. If you cannot push it back, you have 6 hours to get to the emergency room, less than 6 hours, because after 6 hours, the loop, if there is a bowel there, will die. So hernias are a serious problem. And that is why when I see patients with hernia, no symptoms, just found it, I tell them fix it, because you don't know when you'll get into the problem. Other thing is the last thing, the hernias on the groin could be belly button, umbilical hernia, belly button hernias are also very common. And the most important thing is incisional hernias. People who have surgery done before, they can get hernias. They can get hernias in the right side, cesarean section, hysterectomy, in old days, gallbladder surgery. I didn't mention anything about the perforated stomach because any pain lasting for more than 6 hours, you need to go. So the hernias also you have, if the pain is not going away and you feel it's getting hard and painful, please go to the emergency room as soon as possible. So then I will answer any.
Very good. Jyoti ji, questions?
I just want to say everybody's watching, lots of people, and they're appreciating. You spoke very well. So we have two solutions. If you have more than 6 hours pain, you have to consult a doctor. And when doctor diagnose something, you have to, go for surgery, or if it's cancer, then cancer specialist. But don't be scared. Just take care of it. Always take care of the pain. And Dr. Rashmi, people want to know your telephone number, if you can give, please. You want to give?
My office number is 718. I'll write it down.
343-1616. 343-1616. Or you can call me and I can give it to you again.
This is the number. I am available 24 hours a day. I don't give out my cell number because people leave messages that I'm bleeding to death and I don't get the report, message, and then I feel really bad that I didn't respond. So that is the reason I don't give my cell number. But I am available 24 hours a day.
Thank you, my dear. That was really, really very insightful. Even for me, the surgery has gone a long way. Elective surgery, like you said, be aware of the problem you have. So go elective surgery rather than wait for emergencies. So if you find
makes a very, very big, 10 times chances of dying are 10 times more.
Infection,
appendix and gallbladder.
And then the thing is, you go home the same day. This is amazing. What we used to do, they're staying in the hospital 7 days, no more. We go in the morning, सुबह जाओ, बिना खाए पिए जाओ, शाम को आ जाओ, आपको पानी पिला देंगे, खाना नहीं देंगे अभी. But that's very good. Thank you really so much. That was very insightful. Yeah.
Thank you, Dr. Rashmi. You were so busy, but you gave us time to the community. Health is wealth. We always tell everybody our health is our wealth. So we have to take care of, nobody else can take care of.
I just want to tell you one last thing. You can have anything you want in the life. You can have as much money as you want. If you don't have your health, nothing is good.
Absolutely.
Steve Jobs from Apple died of pancreatic cancer. He tried everything. Christina Onassis, the richest woman in the world, died of starvation.
Yeah.
Howard Hughes died of starvation. So money is not the answer. You are healthy, you will live to make money.
Yeah.
So remember, and especially, let me just say one more last thing. Most of us don't take care of ourselves. You take father, son, your this.
Bye
My
bye.
advice to you is that 1 week out of the year, around your birthday, take care of yourself.
Yes.
Do your test, do your medical checkup, and if somebody says anything, you tell them this is my gift to
My
myself.
gift. Absolutely. अब गाना हो जाए. Dr. C loves to listen to the music. Can
I
tell
think
you-
today we heard so good. I think we will skip today.
No,
little
Jyoti
song.
ji, nahi.
Next time, next time.
She likes to hear the music, so give your nice voice, melodious voice to her. So she will like that too. Usko bhi entertain karo na. She gave us so much information.
I
Come
know
on.
she's your best friend, but
Yeah.
I don't know she likes music or not.
Or she does. Yeah. Don't be sure, because अगर आपने अच्छा नहीं गाया,
Okay, I'm just going. I always sing one line. Let me finish.
Yeah.
Dr. Kalra मानेंगे नहीं जब तक मेरी
नहीं.
आवाज नहीं सुनी.
You know her.
मेरे महबूब तुझे मेरी मोहब्बत की कसम मेरे महबूब तुझे मेरी मोहब्बत की कसम आगे की लाइनें नेक्स्ट एपिसोड में.
अरे फिर मुझे सहारा दे दिया.
ज्योति जी, एक बात बता दूं मैं.
या
मैं आपको हर चीज बता सकती हूँ इस गाने के बारे में. किसने गाया,
Oh my God.
किसने लिखा, किसने म्यूजिक दिया.
संगीत, the movie, I know.
हर चीज
Means you
बता
like
सकती हूँ.
this song. That's good. तो फिर हम
No,
आपको
Very
दिखाएंगे कभी.
I love music. Ask Dr. Khan.
Yeah, she does. She really does. She has a
Okay.
line in her house. So रश्मि जी आप भी एक दो लाइन गा दीजिए.
No.
आपको गाना नहीं आता है लेकिन.
No. You go.
Okay, I will definitely go. And you have to tell me what movie it is. तुझे देखा तो ये जाना सनम प्यार होता है दीवाना सनम अब यहाँ से कहाँ जाए हम तेरी बाहों में मर जाए हम तुझे देखा तो ये जाना सनम. Who's the singer? Rashmi.
Udit Narayan and
Oh,
Alka
yes. I knew.
Very good, very good. You're all rounder.
And I can tell you that it is Karishma Kapoor and what's his name? Akshay
No?
Khanna.
करिश्मा कहाँ से आ गई यहाँ पे?
वो उसमें नहीं है क्या? वो क्या नाम है? कौन सी मूवी है ये?
दिलवाले दुल्हनिया ले जाएंगे.
Oh, yes. Sorry, yeah.
Very good.
Kajol.
I'm sorry. She is
Oh,
wrong.
thank you very much. Thank
So
you,
much.
Dr. Jack Kalra. Thank you, Dr. Rashmi, Chardavoyne. We had such a nice session today. See you guys next week, Monday at 12:30 p.m. Our
In New
health
York.
is our wealth.
I am traveling today, so I'll see you back in New
Have
York.
a safe trip, Dr. Kalra.
Thank you. Bye, Rashmi. Bye, Jyoti ji.